All right. Well, you know, one of the last privileges of being the immediate past president of this organization is you get to introduce the next president. And I remember how much. What's that? Okay. I remember how much fun Phil Schauer had in introducing me, and I swore that I'd get back at Phil by getting back at Scott. But I wasn't allowed to do that, and he had a partner in crime that really acted as a firewall and protected him. But I'll do my best to honor Dr. Shikora, who's not just a great surgeon individual, but a great family man. And I guess I'm going to start with this slide, because as long as I've known Scott, we've been colleagues, and we've been on a number of panels, and we've been in countless hours of executive committee meetings. He always begins by, "Hey, Calvin, how's your family?" Not, "How's the practice? I had this bad patient." It's almost, "How's your family?" And so it sort of gives you an idea of the kind of individual Scott is, because as far as I've known him, he's the kind of person that puts his family always before everything else, career, patients, etc. And so here's Scott with his family, his wife Susan, Jonathan, Katie, and Samuel. And I'm not sure if this is in their home, backyard, or their home. I think this is their pet dog, Fluffy. And this is one of my favorite pictures of Scott. And of course, Susan was very kind to send me some other pictures of him. Here you can see how athletic he is, skiing with someone I can't recognize, and out in the orchard picking fruit and enjoying the sunshine with his daughter, attending the graduation of his son from high school. And you know, when you go through these pictures, just look at Scott's face. It doesn't seem to change very much, does it? It sort of gives you an idea of consistency in an individual. Now, Scott has not only been the president, or the current president of the ASMBS, but he's also been president of other major organizations. And this is he's just receiving the award for being president of the Parental and Enteral Nutrition Society as well. So somehow, having children, a family, a career, being a leader, he's also found time to serve. And here he is with some friends in Israel, again, making friendships. You see the same expression on his face, you see what I'm saying? Dr. Segena, of course, everyone knows Scott for his amazing work with neurostimulation, neuromodulation, and things associated with that. Well, that's Scott, the personal individual. And so, leading into that, I think it's important to know the professional side, and you can immediately see my font had to get very small, because there's so much here on the CV, I couldn't possibly put it all on just a few slides. But Scott's a native New Yorker, born in Brooklyn, attended Muhlenberg College, graduated magna cum laude, got his medical degree from Columbia, his surgical residency at New England Deaconess Hospital. He had fellow of nutritional support services there. He's board certified not only in general surgery, critical care, and clinical nutrition. He's been the president, as I said, of ASPEN. He's a professor of surgery at Tufts, chief of minimally invasive surgery, director for the Center for Minimally Invasive Obesity Surgery, and the director for the Obesity Consult Center. Now, you do not know, he's also been in the military. Professor Scott was also Major Scott Shikora, as you can see here, in his uniform. And I've dug up some other photos of him climbing out of his F-4 Phantom or F-16 or F-18. I'm not sure what. Do you remember what kind of plane you were jockeying there? And this also gives an idea that Scott is also a bit of a maverick, right? And so let's go on. He's a member of a number of societies, a College of Surgeons, SAGES, ASPEN, College of Surgeons, Boston Surgical Society, IFSO, and of course, the most important, ASMBS. He's also found the time to do peer review. So he's not only a reviewer, but he's on the editorial board of all of these journals. Too many to name, and very prestigious. Even some in different languages, like Bariatric e Metabolic. He's authored over 25 book chapters, written 3 books, multiple peer review articles that we often refer to in our literature. He's done multimedia productions. He's directed many educational courses, the very well and highly esteemed Bariatric Summit every year in Amelia Island, the Essentials Advanced courses for the ASMBS, the Unified course. He's been voted one of Boston's top surgeons, I understand, as recently. And I think perhaps I consider one of the most important contributions is the Obesity Compendium. Now, I'm not going to take any steam with it. Scott's going to present some of this, but it's just an amazing, amazing amount of work that he spearheaded over the last few years, with he and his colleagues put together. And anyone who's done any of this sort of work understand how many hours it's gone into putting into this. And he did it for the love of the organization, dedication to the patients, because he did it for free. And any proceeds are coming back to the organization. So tremendous amount of work. And in fact, you can see this. Here we are in one of our Marathon Executive Council meetings looking at something on the slide. You can see that everyone is paying attention to the presentation except for, of course, Scott, who's working on the compendium at this time, obviously. And we have some footage of your amazing.
I'm Scott Shikora, ASMBS News. I'm here with Dr. Izzy Greenberg, the Director of Behavioral Medicine of the Obesity Program at Tufts Medical Center. Dr. Greenberg, hello, good to see you.
Tremendous. You can see his amazing interviewing skills coming forth. Right now. But there's more.
Take a small step forward, please. Sorry. A small step to your left, please. To your left.
All right. How does left and...
Your left.
No, I mean...
It's a long day.
I said forward.
Okay.
You're supposed to know that.
I was in the Air Force. We had a march and they'd say left and right, and I always screwed it up, so...
Excellent. Very nice. Left, right, whatever. It's all mirror image on the screen. So, and I also wanted to get some more information, some more dirt, should we say. So I asked his wife, Susan, called her up one day. Hey, was Scott always so comfortable in front of a camera? She says, no, he was kind of the shy, athletic type. That's what sort of drove me to him. Well, is Scott really the nice guy he appears to be? What you see is what you get. A very important question. Did he always have facial hair? I don't think so. And can you send me some more embarrassing pictures? No. Pretty much that was it. So we have some pictures. And to answer some of those questions, the Maverick Scott, we have some pictures. Here's Scott, age 13, his bar mitzvah. Very nice. Very nice. There he is in a motorcycle. Now, I know you want to say, okay, I'll take away this little bit of imagery. That's the real baby-faced Scott Shikora there in his motorcycle. But, you know, my father sold motorcycles for a living. He worked on them. He wouldn't let me have a motorcycle because he was afraid of the kind of people I'd hang around with if I had a motorcycle. But not Scott's parents. Not Scott's parents. They'll let him hang around with anybody. Here he is in high school. And I'll tell you, in our kids' high school, you would not pass the dress code. Okay? Hair's too long, and the beard just wouldn't work. College, medical school, and residency. Now, what does this say? We have pictures of your entire career, except this is all we could muster during residency. It must have been a heck of a... If you didn't have time to pose for a picture except by getting your name badge, you must have been very busy. But who is Scott? Well, let's go Google him. And I'll do what Phil did for me. I just Googled and asked for comments. He's competent. He's confident. He's funny. He's sarcastic. Everything I'd want in a surgeon. Imagine a surgeon sarcastic? Nah. Nothing to say except for awesome. I just got a few things.